Tongue tie is when the frenulum, meaning the tissue that connects the tongue with the lower part of the mouth, is short and thick. Such children find it hard to open their mouths wide enough to breastfeed. It is a common condition that affects 4% to 11% of newborns. The difficulty in babies latching depends on the severity of tongue tie. A simple process called frenotomy helps in snipping the tongue tie. You can easily breastfeed a tongue-tied child with lactation support and medical intervention. Hi, welcome to Nenversa. On this channel, we talk about everything style, confidence, breastfeeding, pumping, and motherhood. If you find this video helpful in any way, please give it a thumbs up and consider subscribe to our channel so you don't miss any of our videos. Babies use their tongues to latch on the nipple properly. They also stick their tongues to form a firm grip while sucking. Some babies with tongue tie might not be able to latch completely or drink with a solid grip. It can also prevent the tongue movement needed to suck the milk from milk ducts. Poor latch and inability to suck milk causes children to refuse the breast. Children with this condition can have multiple issues like breast refusal, poor weight gain, and trouble swallowing. In later years, tongue tie can also cause speech issues in children. When your child is not getting the right amount of breast milk, it will affect his health and level of weight gain. When your little one tries to move his tongue, it looks misshapen or heart-shaped. The frenulum pulls it down to the center of the lower mouth, resulting in restricted tongue movement. You can also feel a firm tissue under his tongue where it connects with the lower mouth. The severity of tongue tie is hard to diagnose. It is good to consult your doctor when you notice something isn't right. Only a professional can access the situation and suggest its solutions. A tongue tie can have several adverse side effects on nursing mothers. Your own mental and physical health can deteriorate to feed your child. Some other consequences can be 1. Low milk supply. A good milk supply builds up when the child latches and sucks breast milk properly. The more you empty your breasts, the more milk you will produce. But a poor latch and ineffective removal of breast milk can lower your milk supply. 2. Early weaning. When children with tongue tie do not get sufficient milk, they lose weight. Poor latch, low milk supply, and a constantly crying child can force the mother to opt for early weaning. According to a study, women usually opt for early weaning if they face difficulty breastfeeding. 3. Emotional stress. Dealing with nursing issues and a fussy child can lead to emotional stress. Breastfeeding can take a toll on mother's mental health if things do not go smoothly. Such mother starts to feel inadequate and incapable of nursing their child, and it causes frustration and emotional stress. 4. Painful breast problems. Poor latch and ineffective milk removal from the breast can cause many breastfeeding problems like cracked and sore nipples, breast engorgement, mastitis, and blocked milk ducts. If you notice that your child cannot breastfeed properly, consult your doctor. It is good to discuss the issues to get things diagnosed. You can also discuss the possible solutions and the pros and cons of frenotomy. Tongue tie is a common issue. It can get better with timely diagnosis and treatment. 1. Use a nipple shield. A nipple shield is a breastfeeding aid. It has a nipple-like shape placed on the breast to help in proper latching. If you decide to use it, please carefully learn how to use it and work closely with your doctor. If you do not use the nipple shields properly, they can even cause further breastfeeding issues for you. 2. Encourage tongue mobility. You can encourage your child's tongue mobility by letting him lick milk from his lips or your nipples, and also by sticking your tongue out and encourage your child to copy you. 3. Try different positions. You can always try different positions and see what works for you and your child. There are several breastfeeding positions like football hold, clutch position, cross-cradle position, and cradle position. 4. Soften your breast. Babies lick the nipples before breastfeeding to soften them naturally. Your tongue-tied child might not be able to do that. You can make your nipples soft by pressing them with all 5 fingers for 1 minute before breastfeeding. It will make it easier for him to latch. 5. Breast pumping. If you feel that your child isn't getting enough milk, it is good to use a breast pump. Please keep in mind that if your child cannot breastfeed, he might as well find it hard to drink from a bottle. You can feed your child a small amount of breast milk with the help of a spoon or syringe. For maintaining your milk supply, you must pump your breast at least 8 times a day. Frenotomy is a simple and easy process where doctors snip the frenulum under your child's tongue to provide a better tongue movement. It doesn't require anesthesia or stitches for newborns. Please always consult a professional for frenotomy. These days, this procedure is becoming very common. If it is done by a non-professional, frenotomy can cause bleeding and infection in some rare cases. You can always ask your doctor for a professional surgeon to perform this procedure. Once your child has a successful frenotomy, you can start breastfeeding again. You will notice his latch and grip for sucking milk will also get better. The impact of a tongue tie on breastfeeding depends on its severity. If you feel there is an issue, always seek a professional's advice and get it sorted. Frenotomy is a simple solution for tongue tie. There are few cases where frenotomy doesn't provide much relief for the mother and child. You can face trouble with breastfeeding even after getting the procedure done. It is good to experiment with different positions or consult a lactation consultant for further advice.